Good morning, I'm Jessica Lovell. Today we bring you an encore presentation of one of our very favorite programs. We'll still be live with you this summer, Monday, Wednesdays, and Fridays, and then come September, we'll be back with our regularly scheduled programming. Until then, enjoy this encore presentation and make it a great day. Seeking relief from persistent pain. It's not easy when doctors don't believe you.
I was not willing to accept that a full hysterectomy was my only solution.
A patient takes control, finding a second opinion that fixed everything. Good morning, I'm Jessica Lovell. Welcome to the Morning Medical Update. Have you ever had persistent pain that you couldn't explain and doctors couldn't pinpoint what it was? Well, today we learn what one woman did to help herself, and she hopes her story can help others. As always, make sure you get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to those right here on your screen. You're about to meet a woman who was forced to become her own health advocate to avoid a major surgery she didn't even need. Alexis Del Cid explains how one woman finally got the help she needed with her own research and a second opinion.
Right it by that freckle.
This small reddish mark on the right side of her neck is the only visible reminder of what Sherry Noller endured.
Today I'm feeling great. I'm feeling wonderful without pain.
The Joplin woman's journey began in June of 2021.
I felt as though I had a constant icy hot feeling inside my body. It was a pain that would radiate down through my left leg down to about my knee, and at the worst of it would also be radiating up my left side into my rib cage.
Even more maddening, it was a pain deep inside her. Sherry couldn't find it, couldn't relieve it with any kind of pressure.
I was also feeling like my hips were just kind of out of joint a little bit. I was trying to stretch, I was trying to move around to get some relief, and nothing would help.
Over several months, she saw multiple doctors and had multiple scans and tests, everything coming up clean, indicating she was perfectly healthy.
It impacted my mental health for sure.
At 38, Sherry felt despair. Then she started doing her own internet searches and she came across something intriguing. Dozens of Facebook pages and groups dedicated to something she'd never heard of, pelvic congestion syndrome. In the simplest terms, varicose veins in the pelvis.
What I found was a community of tens of thousands of women.
She asked her gynecologist in Joplin about it and says she was stunned when the doctor told Sherry that she didn't believe in pelvic congestion syndrome. Even worse,
the only way to remedy pelvic congestion syndrome was to have a full hysterectomy.
Sherry took the reins, reaching out to a doctor at the University of Kansas health system that she'd read about through her various searches, vascular and interventional radiologist Dr. Adam Alley. Dr. Alley took one look at her CAT scan and validated everything. Sherry did have pelvic congestion syndrome, and even better, Dr. Alley could treat it quickly and completely. They would have to go through her jugular vein to do it.
I'm thinking they're going in through my jugular vein.
Right.
Jugular vein. You know, that's a very major vein.
Yes, it is. Sherry Noller joins us now to talk more about this, along with Dr. Aaron Rohr, who specializes in both vascular, interventional radiology, and diagnostic radiology as well. Dr. Rohr, how are you today?
Great.
Happy Friday. Thanks for being with us. Sherry, we just watched your story. How did it feel talking to those doctors first and realizing they just simply didn't believe you?
It really just kind of took my breath away. I had, at that point in time, been through a couple of months of different procedures, and to know that I was feeling something, but then a doctor said that they didn't believe in it was really disheartening, and it took a lot of wind out of my sails in terms of hope that I was going to be able to get relief.
Well, and you ask these questions and you want to open up to your doctor and have that conversation, and we tend to believe what our doctors tell us. So you took this a step further, did your own digging around and found much more information. We're going to talk all about that this morning. And Dr. Rohr, I want to talk more about what pelvic congestion syndrome is and who is most at risk. So we'll talk about that here in just a moment. Okay, so you are VP of Quality and Safety. So I want to ask you about a minor safety issue that ended up being a big deal here at the health system that ended up actually preventing harm to patients in facilities across the entire nation. It has to do with these gait belts. Here they are. Tell us what they're used for, first of all, and then what the change needed to be made.
Yeah, I think this is a great story. And you think about all of the incredibly complex technology we have in a health system, and proton therapy and whatnot. This is a piece of canvas with some metal teeth that basically goes around a patient to help provide a place to hold and support them with a therapist or a nurse who's trying to get them up from a bed or walk them in the hall. Because if you think about it, a lot of folks are in gowns, they don't really have anything to hold on to, and so that belt goes around them. And back in June, we had a patient who was getting up. The therapist was holding onto that belt, and it slipped a little bit. The patient just kind of went down gently to their knees, and no harm happened to that patient. But we ask all of our new employees at orientation to be safety inspectors. We have thousands of people here, and we want every single person to pay attention to things that could be a risk. And this person was very astute, and they realized this belt, which is again just a piece of canvas, was thinner than they normally are, and so that the teeth didn't grab. And so she went and looked at other belts. We realized we had a mix of this new product from the manufacturer that wasn't as sturdy, for lack of a better word. And so we used our patient safety kind of response process, and we were able to use our supply chain, who was great. We swept the entire hospital and made sure that we didn't have any more of these. We pulled any of the thinner belts. But I think the bigger story is we reached out to the FDA. They have a process called MedWatch, and they were then eventually able to send out to the entire country this kind of alert that this could be a risk in other places. So this was a therapist paying very close attention to a very simple piece of technology that impacted, and we got a certificate from the FDA, that team did, recognizing them for impacting safety across the nation. I think that's really cool. So something really simple, but they didn't blow right by it, paid attention, got all our safety people involved, got nationally safety people involved, and made it safer for patients.
And that's what you get when you empower people to be looking for those things, because it's not a problem until it becomes a problem. So you don't notice it until it actually happens. But it takes somebody saying, hey, wait a second, pumping the brakes, and then it turns into something, like you said, a minor thing that turns into a big thing. So yeah.
Before there was harm.
Exactly.
So it was great.
So it is a great story, and we're glad you're here to share that with us this morning. Dr. Williamson, stick around. We may have a couple questions for you from the community, but I want to get back to our guest today, and Dr. Rohr, who's with me here. And we do want to clarify that you did not treat Sherry. That was Dr. Adam Alley, who we met in the story just a moment ago. But explain what pelvic congestion syndrome is and who might be at risk at that.
Yeah, this is one of the rare times in the medical world where the terminology is spot on. So pelvic congestion syndrome is exactly that. It's congestion of the veins in the pelvis. So the veins that typically pump blood back to the heart from the pelvis and the abdomen become incompetent, is what you'll see when you read about it, which basically means they're unable to perform at the level they were before. And as you can see in the graphic there, the main culprits are usually the ovarian veins in women. And when they become incompetent, they're unable to get that blood back, and then they get bogged down and they get dilated, and then they start affecting all the adjacent structures in the pelvis, including the uterus, the ovaries, nerves, etc. So the people who are most at risk for this are women. Other risk factors include pregnancies, multiple pregnancies that come full term. Other things such as varicose veins, spider veins, those types of things are also relative indications that this could be an issue.
Is that hereditary?
Hereditary as well. Yeah, that's a great point. A lot of people who have it in their family tend to reproduce that at later times as well.
You mentioned pregnancy, so is it just having that? Is it being on your feet? Is that pressure that's caused?
It's a combination of that. As you can imagine, there's a lot more blood supply demanded on the body when you're supporting a child for full term. So those veins require more blood to get back, and they have more tension on the system, if you will, and they just become a little blown out and become incompetent and those types of things.
So Dr. Alley and his team knew exactly what this was when he met Sherry. So why might other doctors not even think it existed?
Well, I think it's a culmination of a lot of different factors, but one being it's pretty vague symptoms. So the symptoms can overlap with a lot of other etiologies for pelvic pain, and people can become, unfortunately, dismissive at that time. The other thing is just lack of awareness. It's kind of something that's grown throughout the medical community over the years, where we now have imaging criteria and diagnostics to say, yes, this is exactly what it is. So it's a little bit of both and kind of overshadowed by some other vague symptoms that can be attributed to pelvic congestion syndrome.
So Sherry, at first, the only option doctors were giving you was a full hysterectomy. You said, no way. How did you go about finding Dr. Alley? Tell us about the research, and this is kind of the good power of social media.
Yes, and so at the point in time when pelvic congestion syndrome came on my radar, I was seeing my general practice, my general physician, and he was like, "Okay, we're at the time where I think you need to go see your OBGYN because I've exhausted all my options." And so in the time that I was waiting to get that appointment, I was listening to what the doctor was saying, because what I was saying about where my pain was and what my pain was, my doctors were saying something different. They're like, it's your lower left quadrant abdominal pain. And so I started kind of using the words that the doctors were telling me and doing some Google searches. When I came across either medical sites or in the particular case of how I found Dr. Alley through the University of Kansas healthcare site. Then I went on to Facebook and I started searching the pelvic congestion syndrome, and that's when I found the various different communities, and I joined one, not really knowing that this was what I was thinking it was, but really just kind of trying to go out there and see and hear from other women, what is it that they are experiencing? Is that something that I'm experiencing? Because I don't want to just go off of an internet search. So I was trying to do information gathering for myself and understand, do I think I align with what some of these other folks are saying, or do I need to maybe look a different direction? And what I found in the community that I joined was there were multiple different options. I mean, there were nutcracker syndrome was one that came up, but pelvic congestion syndrome was one that was coming up. And in the posts that I was seeing, there were women saying, hey, ask your doctor about pelvic congestion syndrome because it may shine more light on what you're going through, more so than this other, potentially this other diagnosis. And so I was reading that. I kind of stayed in tune to what that group was saying. And then I had my appointment with my OBGYN, and that's when the idea of pelvic congestion syndrome was kind of dismissed. And when that's not really a thing. I think we need to send you for second opinions and do a couple of other things before we make a decision. And that's what I did. I got second opinions and came back to the doctor with no answers that made sense, and no answers from any other doctors. They said, this isn't a gastro issue. It's not any other issue. And so then my option was full hysterectomy or exploratory surgery. And, at the time being 38 years old, neither option sound like a reasonable option to me, especially since I had been doing some research and in that in-between time was doing what I could to connect with Dr. Alley and the University of Kansas healthcare system so that I could get another opinion and be believed.
I have to, and here you are, and we always say don't believe everything you read on the internet, certainly when it comes to to health and healthcare. But in this case, Dr. Orr, I have to ask you, she knew something was up and did her own research. What do you make of that? And when can that work for someone really well?
It's not as uncommon as you think.
Yeah.
And when I see patients that have similar stories, such as yourself in my clinic, the first thing I do is congratulate you, because I think the underlying theme here is being your own advocate works really well in a lot of cases. So kudos to you for going the extra mile and making that happen. But it's unfortunately not uncommon, and attention to detail and getting second opinions is always warranted, and congratulations to you for doing that.
Okay, so we saw that Sherry had a procedure that started in her jugular, and she even mentioned in her story, like, my jugular vein. I mean, that's some serious stuff, but it seems a very long way from the jugular down to the pelvic area. Why go that route?
That's a great question, and it truly is provider preference. Dr. Alley and I treat these patients with the symptom almost identically in that fact that we go through the jugular vein. It kind of gives you a straight shot from the neck to the groin versus it's coming up through the groin and doing pretty much a full loop 180 U-turn there. So it gives you a really good foundation to perform the procedure. We have a lot of long catheters and sheaths and fun stuff that can get us there, so that's usually not as big of a deal, but yeah, it can be daunting knowing that all this is going to happen through the big vein in your neck.
Yeah, right. Okay, so let's check out this x-ray from Sherry's case. Just kind of explain what we're seeing here.
So this is pretty much exactly what we were talking about. So up towards the top of the picture is towards the head or the jugular vein, and that catheter you can see is kind of dipping down into that coil pack. And so those metallic things all throughout the left side are coils throughout the ovarian vein, the one that we had on the graphic before. And as you can see at the top of it, you can make out there's a little bit of contrast there on top of the coils. So that's Dr. Alley saying, okay, I've coiled this thing off, it's completely embolized, it's no longer functional, and here's the contrast to prove it. So that's what that's kind of stating or showing after the procedure has been completed.
Sherry, how are you doing today? How are you feeling? Is this behind you? And what kind of future care do you have?
Yeah, so it is behind me. The pain, the persistent, consistent pain is behind me. I am doing everything that I want to do, staying as active. I'm able to follow my kids around to all their activities and sports, and it's really something that I don't give a second thought to anymore. And as I mentioned in the piece, my mental health was really starting to take a toll, because as much as I was trying to relieve my own pain through pain relievers or stretching or doing all of these things and not getting relief, and then going through the different doctor's appointments, it was really taking a toll. And so I didn't want to be as active, but I'm very busy, a lot of things going on, lots of stuff happening at work. I've got a high school freshman who's, they're planning a big trip for next year, so I'm actively involved in helping get that going. I've got a 9-year-old who's running around to all sorts of sports. So, there's no slowing down for me now.
Doc, that's kind of just what you really want to hear, isn't it?
Yeah, that's the music to our ears.
Exactly. So good to hear. Let's check and see if we have any reporter questions on the line today. Well, let's get to our community questions, shall we? Sarah wants to know what recovery was like for you. Sherry, were you down for the count for a bit?
No, actually, after the procedure, I did stay in my room for a couple of hours just for monitoring, and then my husband was able to take me home. So because, again, I'm down in the Joplin area, so because of our location being within 2 to 3 hours, I was able to go home that night. And from one of the pictures you saw, I had a large gauze bandage on my neck with kind of a big adhesive sheet to keep that in place, and that I was supposed to keep on for 24 hours and just kind of take it easy for 2 to 3 days afterwards, which really kind of meant no significant twisting and just watching my activity level, but that's all that my recovery was. And when I came out of the procedure, I immediately felt better. So I was pretty excited to get up and moving again, but I did take it easy. But following that, I didn't have any significant follow-up. I followed up with Dr. Alley about 4 to 6 weeks after the procedure, and since then have not needed any additional follow-up, and I haven't had any additional issues.
I want to ask both of our doctors about this one. Ruth Ellen says, how can it happen that a doctor doesn't believe in a possible diagnosis that a patient asks about? Dr. Williamson, she says, that troubles me. What advice would you have hearing a story like Sherry's? And when people hear that a doctor didn't believe them, not everybody would be as savvy maybe to do what Sherry did and hit the internet and be able to find groups. What do you make of it?
Yeah, I think it's terribly unfortunate, and I take care of a rare disease called pulmonary hypertension, and I not infrequently have folks who have found their way to us because they were told they had other things or maybe not believed at all, as in this case. So I think being your own best advocate, which Sherry did, is just fabulous. And I've done medicine for a while now, and so one of my mantras is always to keep an open mind and explore and kind of help explore those other possibilities that it might be. But we encourage everyone to do that. But a lot of patients come here to the health system for that exact reason, is that they've not been able to get the answers, and their research has kind of guided them to us. So that's unfortunately, or fortunately for us, but unfortunately, it's not an uncommon phenomenon that people come to us by that very pathway.
Yeah, makes sense. Dr. War, I mean, I think patients want to lean on their doctors for answers, but they also want to feel like it's a partnership and they're kind of walking alongside with their health care. Just what do you say to someone like Ruth, who that is concerning when you hear that? No one wants to think that they're not believed. Yeah,
it is truly concerning, and to kind of piggyback on Dr. Williamson's thoughts, it's unfortunate, it happens, but it is good to build that relationship and team, if you will, with your own health care. There's no great answer to why some people do or don't believe in certain things in that nature. But one thing we do know is that we see it often, and to echo some similar thoughts, this is a big center. We see it. We have a lot of subspecialists in these areas who run into these things a little more often than most, and so it's nice to be able to share that experience with patients and reassure them that we're on the right track.
Sherry, a question for you is, what was the physician's response who didn't believe you? Have you been back in touch with them to say, aha, I did my own research and I figured this out on my own?
I have not gone back to that specific doctor. I did go back to the practice because that has been my OBGYN practice. And I did share my experience with the nurse that I saw, and just shared my experience, and of course you have to update them on any new procedures that you had since your last appointment, and so I just went ahead and I shared my story. I shared what had happened and the experience that I had had in the office, and the response that I got was, well, that's interesting. I'll have to do some more research into that. And I will say too, to your question, and to your previous question, it was my understanding from Dr. Alley that the dilated veins that I was showing are quite common, but it's not common that everyone is going to have pain from dilated veins either. And so I think that probably complicates the issue a little bit for those doctors that have maybe seen it before. But to understand that there is a segment of the population that may appear to have the same symptoms as another patient, but that patient could be having significant pain, whereas the other patient isn't.
Well, Linda was just asking, are there other symptoms of pelvic congestion syndrome besides pain that people need to be on the lookout for?
Yeah, again, it's kind of overlapping syndromes with a lot of different things. Pain, bloating. One of the hallmarks of pelvic congestion syndrome actually is positional pain. It's one thing that kind of separates it a little more from others, where gravity kind of does its thing and pulls this blood down into the pelvis, and that's when you become uncomfortable standing, walking on your feet all day. Patients typically have the same story of, when I lie down or I go in this position, I feel much better. And I don't know if that was your case or not, but we typically see that a fair amount, and that kind of helps us discern some of those. But yeah, it can be pretty vague until you get some of these more specific, teased out kind of symptoms.
A question from Jeremy, and I'll give this to Dr. Williamson. And we touched on this, but I think we just kind of brought up a really good topic. Jeremy wants to know, what's the most helpful thing we can say to our doctors that help them to diagnose when it's hard to tell what's happening? When you're the one experiencing the symptoms, but maybe best knowing how to communicate that when it's hard to know what it is and there's no direct answer. What advice might you have?
That's a great question. Interested in Dr. Werer's opinion as well. As I think just be as specific as you can about what you're feeling. And I get sometimes it's hard to be specific. In my world, sometimes there's a lot of overlap between shortness of breath and fatigue and tiredness, and so just tell folks what you're feeling and really get all of those symptoms out there. And sometimes they feel like they're not connected, but maybe they are connected in some way. And then I do think there's parts of the population that are really worried about offending their doctor or making their doctor mad. But my hope is that most physicians and other providers would be open that if you need to seek additional opinions. I never discourage if I'm not able to provide someone answers or having trouble getting to the right answer. I'm open for people seeking second opinions. So I think certainly tell your doctor everything that's going on. But if you're not quite getting the answers or feel like you're being heard even, then certainly finding other providers to tell that story to is very reasonable.
And that's why we talk about our second opinions. I mean, we either send people for second opinions or we often are the second opinion. Either way, we want those second opinions heard. You talked about the overlapping of different, and it could be in all sorts of areas of medicine, but the overlapping of different symptoms can be really confusing for a patient.
Yeah, absolutely. And again, it's more of telling your story, making sure that all your symptoms are explained, imaging is reviewed thoroughly if you need second opinions on that as well. They all kind of come together. And to your point earlier that you made, an enlarged vein in the pelvis doesn't necessarily mean you have pelvic congestion syndrome. It's something we see commonly, but when you start putting those pieces together from the puzzle of, oh, they are having this pain, it is positional, we do have imaging diagnosis to say that there is enlarged veins there, then things start to come together a little more, and sometimes it needs more than one set of eyes.
I'm going to give you last question, and you touched on it a little bit earlier, but Jared asking if men can get pelvic congestion syndrome. Is it called the same thing? Could they get those enlarged veins down in that area?
Yeah, technically it is the same. So the same incompetent vein, the gonadal vein. So in the woman, it's the ovarian vein, which we showed a graphic of. In the men, it would be the testicular vein, and that's called a varicocele. They present a little bit differently, but it's the same type of pathophysiology.
But they don't get it as often?
Correct. Not as often as far as the pelvic pain associated with pelvic congestion. So rarely do men present with the prostate discomfort and some of the pelvic discomforts that you would see, and it's more of a testicular issue that's treated independently.
Really interesting conversation. I had not heard of this issue, so I hope other people learned a lot about pelvic congestion syndrome today. And Sherry, we appreciate you sharing your story with us. I want you to give us your final thoughts, but we just had one last question about just your best advice for people seeking answers and wanting to know more about where to go.
Yeah, and my advice there would be do the research, talk to people, gather information. I mean, one of the things that I was really trying to be careful of when I was doing internet searches, and even when I had joined the Facebook group, was I need to look at this through the lens of, am I only reading and getting the information that I want, or am I reading to understand what others are going through or what this website is telling me? And I was also very cautious not to just click on any website. I was making sure that the websites I was clicking on were health and hospital organizations. Again, just we've heard all of the things about patients Googling their symptoms, and all of a sudden they come in and they think that it's worse than it is. And so I was just really trying to be cautious, and it's part of my personality as well, where I try to gather more information so that I'm not just getting it from one source, again, to better understand is what I think that's going on, is that what's going on? And this has really been the only time where I have done that, and it's worked out in this particular manner. Because when I've, done general searches before, or when I've had issues, I've gone to the doctor and everything has been easily explainable. So my advice is, to be your advocate, to love yourself enough that you are going to put forth the effort to find answers for yourself, just as you would for your family. And I say that as a mom to other moms and caregivers out there, because I was really great at making sure that the rest of my family had their regular doctor's appointments and fighting for answers when answers weren't available, but I wasn't always my best advocate. And so just know that you're worth it as well, and that you need to take the time to take care of yourself. And that was honestly a pretty empowering thing for me to go through, and for me to just kind of journey through, because I am one that I don't like to push back on my doctors. I have a lot of trust in my doctors, but I was at a point where I had to do more for myself. So that's what I would advise others, is just making sure that you're doing what you think is right for yourself.
Great message. Sherry, thank you so much for sharing your story. We appreciate you. Dr. Rohr, final thoughts?
Yeah, it's tough to put it better than Sherry just did. I mean, that's exactly right. It's a very powerful message about being your own advocate, and being able to trust yourself and look in the right directions, yet not get misled. And that's a lot of it's a daunting task, I guess I should say, for a patient. And it's a very powerful message that you delivered, and I don't have much to add to it.
Good stuff. Thanks for being with us today. Dr. Williamson, good to see you today.
Yeah, it was great to be here. And I think Sherry did a fabulous job of navigating the worldwide interweb. I mean, the amount of misinformation we know out there, and I think the approach she took was fabulous. I just wanted to reiterate a thing or two I think Dr. Rohr said earlier. There are some of these things that are relatively rare, but by being a place that sees a lot of the rare stuff from all over the country, that gives us that opportunity, and having that multidisciplinary approach that we can work together. For me, these things, it's 2, 3, 4, 5 different disciplines working together. So that's why we're here, and there are a lot of great people taking great care of patients all over the country. But sometimes if things are a little more rare, then that's a great time to seek additional information, and that's exactly why we're here.
That's what you do. All right, Dr. Williamson, thank you so much. Thank you to Sherry and Dr. Rohr, and thank you for joining us today.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcasts. Now everywhere podcasts are available.